Hi, I'm Dr. Keith Ryan, chiropractor in Tulsa, Oklahoma. I wanted to talk to you about hip pain. And primarily when I'm talking about hip pain, I'm talking about the top of your femur, the ball that comes right into the side of your hip. Now, a lot of people don't realize that that can get out of place in and of itself. Most people think that that just sits in there freely and articulates and turns and moves when you walk. But I've found that's really not the case a lot of times. A lot of times that femur head on that ball and socket that's in there just gets stuck a little bit and it just doesn't move. And a lot of times you find out that by you're trying to stretch and you're like trying to touch your hands to the floor, or you're trying to touch your toes and you're just, well, shoot, I'm just not very limber. But it turns out you probably are limber. It's just your hip is stuck. And you adjust that hip and you get it moving and you have really free range of motion to stretch a lot further. Now, having your hip out of place can cause you all kinds of problems. It can cause you, if you're a runner, not to run fast. If your hips are out of place, it can cause your back and your sacroiliac joints to hurt because it's just not working right. So having your hip out of place can really turn into a big problem for a fairly simple way to correct it. But you have to be able to get that joint moving right. And you can see it right when you do it. You can test it by laying on your back and lifting, have someone lift your leg up. You can feel where it's stuck and you can feel where the hip's not moving. And you just adjust that hip, get it to move properly, and then you can bring that leg up so much further. It's really just a kind of amazing thing. So if you're having any one of these problems with your hip and your femur head, come get it adjusted, and you'll really be glad you did, and you'll see the difference. Thanks so much.